Weakness of one side of the body is not a spiritual attack. It is not black magic, neither is it your village people chasing you. It is a medical condition known as hemiplegia, which means that you have had a stroke. Our body parts and organs, including the brain, all rely on oxygen to function. And the way that they get this oxygen is through the blood that runs into our blood vessels, known as the arteries. If for any reason blood is stopped from reaching any part of the brain for a specific period of time, a person has a stroke. This leads to weakness of one side of the body, amongst other things. And the reason why this happens is because our brain is responsible for controlling a lot of functions, including movement. Now, a lot of people are under the belief that when stroke happens, there's a particular drug or medicine that you can take in or apply that will make the arm or the leg to start moving. This is a wrong belief. Run away from anybody who says or who goes under any guise to tell you that they have something to give you to rub on the arm or on the leg to help you to regain function. The one thing that is sure to help someone who has suffered a stroke to regain function is physiotherapy. And it is really important to start physiotherapy as soon as a person suffers a stroke to avoid complications that will hinder the person's ability to regain function. My motto has always been safety first. So let us address some factors that put you at risk of having a stroke. The first is hypertension, which is one of the commonest causes of stroke. So if you are told that you're hypertensive, please take your medication seriously and make sure that you go for regular checkups in the hospital to ensure that your blood pressure is kept within normal limits. If you are diabetic, ensure that you're regular on your medications and hospital follow-ups as well, because a persistently high blood sugar can also put you at risk for suffering a stroke. Smokers, please stop. It puts you at a high risk for having a stroke as well. Now, if you have a heart disease, also ensure that you treat it accordingly, because that is another risk factor. If you have high cholesterol levels, adhere to a proper low cholesterol diet together with your prescribed medications in order to keep it within normal levels. Being obese or overweight also puts you at a great risk of having a stroke. So seriously consider losing weight in order to improve your health. Now, this one has become my mantra. Exercise regularly. Exercise generally improves your overall health and boosts your immunity. Well, that's it for now. See you in another minute.